The meeting of the Committee of Public Accounts is called to order.
On the part of the Committee on Good Government and Public Accountability, this meeting is called to order.
May I request everyone to please rise for our short prayer. We offer this prayer, our dear Lord, for the reposed soul of our dear friend and comrade, Congressman Jun Datol. Congressman Jun Datol has been very active in all our committee hearings, even during COVID, especially that of the Public Accounts and Good Government Committee, and also of the Committee of Health. During COVID, Congressman Datol has been going around giving support and assistance to our senior citizens, providing them with vitamins, alcohol, food, and face masks. And in many occasions, we have individually warned Congressman Datol that because of his age, this might affect him. And so this committee hearing, and to all our colleagues who are here right now, we offer this to him. And we pray, dear Lord, that you guide us, that we will be able to thresh out what is good for our country and what is good for our people. We ask this through your Son, our Lord Jesus Christ. Amen. Please rise for our national anthem.
Bayang magiliw, perlas ng silanganan, alam ng puso, sa titik mo'y buhay. Lupang hinirang, duyan ka ng magiting, sa manlulupit, di ka pasisilil. Sa dagat at bundok, sa simoy at sa langit mong baghaw, ay nilang ang tula at awit sa paglayang nilamahal. Ang kisap ng wataw at mo'y tagumpay na nagdidinig, ang bituin at araw niya kailan pang may magdidilig. Lupa ng araw ng maraming pagsikta, buhay ay langit sa atin ko. Aming ligaya dapat may mga ating pagmamatay ng dahil sa'yo.
Thank you and good morning to everyone. Before we start, let me just recognize the senior Vice Chairman and our senior Majority Deputy Leader, the Honorable Boying Remulla, who's here with us on the floor. Let me also recognize our Deputy Speaker, Dan Fernandez. May I now request the Committee Secretary to recognize the members of the Committees of Public Accountability, Public Accounts, and the committee members of the Committee on Good Government, Public Accountability who are in Zoom. So directed, Comsec.
Good morning, Your Honor. Via Zoom are the following members of both committees. The Honorable Ted Aresco, the Honorable Elpidio Barzaga, the Honorable Carlos Zarate, Honorable Enrico Pineda, Honorable Sol Aragones, the Honorable Stella Kimbo, the Honorable Maricel Nagano, the Honorable Gabriel Bordado, the Honorable the Honorable Bolilia, Honorable Robert Ace Barbers, Honorable Janet Garin, Honorable Coco Nograles, Honorable Lollipop Duano Dizon, and the Honorable Franz Castro and the Honorable Benny Abante. And also the Honorable Marcoleta, Your Honor.
Maraming salamat, Comsec. Kumari din pong kilalanin ang mga guests po natin ngayon na nasa plenary at yung ating pong guest na nasa Zoom. Comsec.
Your Honor, joining us in plenary are the following resource persons. Via Zoom, the representative of DOH and a representative from Department of Justice. We also have Administrator Hans Leo Kakdak from OWA. We have President Morales from the Philhealth, We have Executive Vice President Arnel De Jesus from Philhealth via Zoom. And Brigadier General Augustus De Villa, Renato Limsiaco, Dennis Mas, Attorney Rodolfo Del Rosario Jr., Israel Francis Pargas, Nerissa Santiago, Rustico Jimenez from the Private Hospital Association of the Philippines, and Commissioner Michael P. Cloribel from Governance Commission. We have a representative from the Department of Budget and Management. We also have a representative from the COA, and Dr. Jaime Almora from the Philippine Hospital Association, represented by Dr. B. Castro. We have a Regional Director of the NBI, Olivo Ramos, and Vernon Firmalino, an investigator from the NBI. Your Honor.
Maraming salamat. Una po sa lahat, nais ko po lang pong ilinaw na... Oh, I'm sorry. Go ahead, Comsec. Can you recognize our guest in plenary?
And joining us in plenary, Your Honor, we have Vita Limsiaco. Nerissa Santiago, Maria Graciela Gonzaga, Mr. Ruben Padua, Dennis Mas, and Mr. Calixto. That's all, Your Honor.
Maraming salamat. Una po sa lahat, nais ko lang hong ilinaw na ang committee hearing po na ito ay hindi na lang po sa Committee ng Public Accounts, kundi po pumasok na rin po ang Committee on Good Government and Public Accountability sa kadahilanan na titingnan na po ang kabuuang problema sa ating pong sektor na pangkalusugan. And so, in so doing, we did not only tackle the operations of the government offices and agencies, pero nag-involve na rin po ito ng private sector. Pangalawa ho, just so that the members of the committee, both of the public accounts and the good government public accountability, para po magkaroon ng ayos yung ating pag-uusap, isa-isahin po natin yung topic na ating i-discuss. Ang una po, dahil nasimulan na rin po naman natin to, ay yung all-case rate na pag-uusap. And in relation dun sa all-case rate, ay yung pong pag-uusap sa interim reimbursement mechanism. Pangatlo ho, at konektado rin po sa finance, yung mismong kabuang Philhealth Finance. This was asked by the Honorable Kimbo the last time. No? So, idikit-dikit po natin yon. At yung mga lumabas na issue, pang-apat, yung computerization, pang-lima, yung OFW contribution, pang-anim, yung testing. At pang-pito, kung sakasakali ho, yung mga maghahalo na rin po to with the all-case rate, ay yung mga hospitals, no? Particular na mga issue sa mga hospitals at yung nakikitang problema sa all-case rate. So, with that, we will proceed with the discussion, but may I ask the Honorable Rimulya, as regards the disposition of this investigation, ano po ba ang kahalagahan ng investigasyon natin na alam naman po natin kahapon nagkaroon ng hearing ang Senado at patuloy na rin po na nagkakaroon ng hearing ang ating eksekutibo. So may recognize the Honorable Rimulya.
Thank you, Mr. Chairman. Good morning. Marami hong nagtatanong kung bakit kailangan pa ng House of Representatives na mag-imbestiga ng Philhealth, gayon naman na ando na ang Senado at ando na ang DOJ na nag-iimbestiga ng mga problema ng Philhealth. Ngayon, ang humaharap po sa inyo ngayon ay dalawang komite. Ang Committee on Public Accounts na ang tinitingnan niya po ang pananalapi ng ating bayan at ang mga pananalapi na kinakailangan bantayan sapagkat ito po ay nanggagaling sa taong bayan. At ang pangalawa pong committee na hinaharap nyo ngayon ay ang Committee on Good Government and Public Accountability na siya ring House Blue Ribbon Committee. May investigasyon na nga ang DOJ, maaari pong mag-imbestiga rin ang Ombudsman, maaari pong ituloy-tuloy ng COA ang kanyang pag-audit, ngunit mahalaga sa process po ng paggawa ng batas, pag tayo po ay gumagawa ng batas, ay ang investigasyon po ay mahalaga. Dalawa po ang sangay ng ating legislative department. Meron po tayong Senado at meron po tayong House of Representatives. At ang perspective po na nanggagaling sa Senado ay kakaiba sa perspective na nanggagaling sa House of Representatives. At alam natin na sa bicameral legislature, kinakailangan po magkasundo pareho ang House at Senate para magkaroon ng batas na kalalabasan ang kahit na anong investigasyon. Kaya hindi po ito superfluity, hindi po ito sobra-sobrang nagpapatong-patong na investigasyon sapagkat iba-ibang perspektibo po nanggagaling ang mga tanong namin. Ang abiso lang namin sa aming mga miyembro ay panoorin din po ang Senate hearings at panoorin at alamin din ang ginagawa ng DOJ para alam natin ang lahat ng kinikilos ng lahat ng ahensya nang maging kompleto ang pagtingin sa lahat ng mga bagay-bagay na maaring sumambulat sa lahat ng mga investigasyon. Kaya kung tatanungin po kung bakit sabay-sabay nag-iimbestiga ang ibang sangay ng gobyerno, marahil ang pinakamagandang sagot dito, ang bawat Pilipino ay miyembro ng Philhealth. At dapat lang na ang lahat na maaaring magbantay sa kaban ng bayan ay magbantay na at magtanong ng mga kinakailangan itanong upang matapos ang mga alinlangan natin sa ating Philhealth. Kasi marami hong lumabas na hindi ka nais-nais na balita na ngayon dapat po magkaroon tayo ng closure at magkaroon po tayo ng solusyon para sa kinabukasan ng Philhealth at sa kinabukasan ng ating health policy sa Republika ng Pilipinas. Yun po ang dahilan kung bakit ang iba't ibang sangay ng gobyerno ay maaari pong mag-imbestiga nang hindi naman nagpapatong, kahit na sinasabi nagpapatong-patong, ay iba-iba ang pinanggagalingan naming lahat. Yun lang po, Mr. Chairman.
Maraming salamat, Senior Vice Chairman, our Senior Deputy Majority Floor Leader, Congressman Boying Rimulya. The Honorable Fernandez, like to be
Yeah, Mr.
recognized.
Chairman, thank you so much, and I totally agree with Congressman Remulla, and at the same time, I agree with the Chair that we categorize the different issues that we're going to tackle today, precisely because mahirap pong pagsama-samahin yung mga issues, and by doing this, we will be able to tackle each and every issue with certainty. With that, Mr. Chairman, ay sana po ay pakinggan din po natin yung mga presentation ng ating mga resource speakers for today. Yun lang po, Mr. Chairman.
Thank you.
Mr. Chairman.
Yes, Honorable Rimulya.
Yes, Mr. Chairman, meron lang ako bago tayo magsimula sa iba't ibang mga katanungan na lalabas po sa investigasyon na ito. Nais ko lang po linawin muna yung isang bagay na bumabagabag sa akin. Andito ho si Nerissa Santiago, Senior Vice President. Kayo po ay naglabas ng isang statement na sabi nyo ang actuarial life ng Philhealth ay maaring 1 taon na lang lamang. Pwede ba hong pakilinaw ito at ipaliwanag sa amin kung bakit nyo po nasabi ito sapagkat ito po ay nakakagambala at maaari pong matapos po ang usapin na ito bago tayo magsimula.
Go ahead, Philhealth recognized.
Thank you. Good morning, Mr. House Speaker and the rest of the honorable members of the House. Regarding po dun sa 1 year na lang po, at actually it's based on assumptions po, projections. That means, tinitingnan po natin kung ano po yung probable na papasok na pera at ilalabas natin na pera. So, for this year, we have an actual figures as of June na mapagbabasehan po natin ng actual na pumasok na pera, although yung benefits, hindi pa rin po actual kasi we have given the hospitals 120 days to submit their claims instead of the usual 60 days po. So kung halimbawa po na ospital ng Marso, mabibigay pa po yan 4 months after. Meron po silang 4 months to submit yung claims. Kaya po hindi po ganun kadami yung aming basis for the benefit payouts. So, yun po, bali yung projection po na 1 year is yung papasok po na pera, so yun po yung collection na manggagaling sa indirect, which is the subsidy coming from the government for the premiums of the indirect contributors, and yung pong sa direct contributors na collection na manggagaling po sa kanila. So, dalawa po yung panggagalingan natin. So, for 2020 po, nakita po namin na for April, May, June, bumaba po ang ating collection because of the slowdown of the economy. So, yun po yung pinagbasihan natin for the rest of the year, average po nung marireceive natin. So, for the direct muna po, we expect na yun sa government, we will still get what, as an employer, we will still get yung kasi hindi naman po sila, kumbaga, ang gobyerno naman po, tuloy-tuloy po ang bayad. So on the employed, private employed sector, ito po yung merong mga nagsara, may mga na-lay off, may mga na-retrench at hindi na makatrabaho. So yun po yung dahilan kung bakit bababa. Yung po sa informal naman po, ito naman po yung individually paying. So kung makakabayad po sila, magbabayad sila. So kung wala po silang trabaho, hindi po sila magbabayad. So basically, yung pong pasok ng pera, bumaba po for 2020. And for the benefit payout naman po, yung paglabas ng pera for 2020, because of the COVID pandemic, we expect a higher benefit payout. Kasama po dito yung COVID inpatient at saka COVID testing. So dahil po, dalawa po yung side na naapektuhan, bumaba ang collection at tumaas ang benefit payout for 2020, kakain po to sa reserve fund. Ibig sabihin, may deficit po tayo between benefits and collection. Mas mataas po yung benefit payouts natin kaysa sa collection.
SVP Ignacio, Honorable Remulla,
Ay,
if
sorry.
you recall, dun sa pag-usap natin, kung papayag po kayo, we go to the all case rate,
Okay.
and then we proceed to IRM, and then ito pong finance that you are asking now.
Itutuloy ko ho sa case rate to pagkatapos. Nasa next question ko sa case rate na po.
Okay.
Pwede.
Okay. Just so the members are clarified, Honorable Remulla, after you, the Honorable Sarate, Barbers, Marcoleta, and Kimbo will be doing their interpellation. Go ahead, continue.
Tuloy niyo po yung sagot niyo. Tapos,
Pagdating po sa 2021, dahil po meron po tayong recession in 2020, in-expect po natin na even in 2021, bababa po yung ating collection. So may in-expect po kami, ang inassume po namin doon is a decrease of about 25% in the direct 25% decrease in terms of direct contributors. Pagdating po sa indirect, we have proposed to DBM na 138 po sana, 138 billion ang i-allot sa amin sa GAA for 2021. Kaya lang po na we got advice na they will only give us 71 billion na pareho po siya nitong 2020. So, in that aspect po, mababa po yung makukuha natin na collection in 2021.
so, Ms. Santiago, you're a practicing actuary.
Apo.
You're a math major.
Yes.
Math talaga ang ano niyo.
Yes po.
So, pagdating po dito, so let's go to the case rates, no, Mr. Chairman. So, if I may begin. How many cases does Philhealth recognize all case rates? Anybody? Mr. Pargas.
Mr. Chair,
Go ahead.
Mr. Congressman, yes, sir. We have around more than 4,000 cases for the medical illnesses, and for the surgical procedures, we have more than 4,000 case rates also, sir.
You mean 4,000 types of case rates?
Yes, sir.
Ano ho ang pinakamaraming case rate na binabayaran ng all case rate na binabayaran ng PhilHealth sa ngayon? Give me the top 5 or top 6 case rates, all case rates that PhilHealth has paid.
Mr. Chairman, if I may, point of order.
Yes, go ahead.
I move that we take the oath of all the resource speakers
Oath muna.
for today's hearing.
Thank you for that, Honorable Fernandez. With the indulgence of our guests, those who are here and those in Zoom, may we request you to take your oath before we continue with our interpellation. The committee secretaries directed, the Honorable Comsec Marivic, kindly swear in our guest. So ordered.
Please stand and raise your right hand. is also applied to those resource person participating via Zoom. Do you swear to tell the truth, the whole truth, and nothing but the truth before this hearing? So help you God? Thank you.
Marami pong salamat. Honorable Rimulya, kindly continue. The reply on the question of the Honorable Rimulya.
Yes, ano yung 6 na pinakamatataas na pito na? Pinakamatataas na binabayaran ng Philhealth sa all case rate and corresponding amount for the year 2018 para may sample lang ho tayo sa isang taon.
Mr. Chair, Mr. Congressman, sir, the data I have here is for 2019. If it's,
Sige, 2019.
for the medical case rates by claims count po, the number 1 is community-acquired pneumonia. Number 2 is dengue. Number 3 is, this is the dengue hemorrhagic fever with warning signs. The number 3 is UTI. The number 4 is acute gastroenteritis. The number 5 is still dengue without the warning signs. This is the dengue one. Then we have the bacterial sepsis of the newborn unspecified. Then number 7 is bronchial asthma in acute exacerbation. Number 8 is hypertension, stage 2. Number 1 is essential hypertension, and the last is acute gastroenteritis. For the procedures, by claims count, it is hemodialysis. Number 2 is obstetric care. This is the normal spontaneous delivery. The newborn care package. Then the expanded newborn care package, we have the routine obstetric, which is in the non-hospital facility, cesarean, delivery primary, the vaginal delivery with episiotomy, then the chemotherapy, cesarean, and then the cataract as number 10. For the amount, sir, for 2019, the dialysis procedure is around 10 billion. The obstetric normal spontaneous delivery in hospitals is 2.4 billion. The newborn care package is around 722 million. The expanded newborn is at 1.1 billion. Those in the maternity care package at 2.3, this is in the non-hospital facility. Cesarean for primary is 3.5. Vaginal delivery only at 1.3, then chemo at 943, cesarean delivery at 2.2, and for the cataract removal, it's 1.6 billion. For
Dr.
pneumonia,
Pargas, teka sandali, Dr. Pargas. Sa lahat ng ito, nagwi-withhold ba ang Philhealth ng taxes para sa mga doctor's fees?
ang ating pong withholding tax ay naka-charge po sa hospitals, at ang sa professional fee naman po, ang mga hospitals po ang nag-deduct ng withholding tax. Because the case rate as it is provided and paid to the hospital as a whole package po. It is the hospital who brings or who gives the payment to the professionals.
So, pagdating po sa sabihin natin, no? Pneumonia, maraming klaseng pneumonia po, di ba? May moderate, merong mild, tsaka merong severe. Tama ba ho yun?
Yes po.
Ang inyong mild pneumonia, 44,000 ang package.
Mr. President, Mr. Chair, Mr. Congressman, yun pong sa mild, moderate, and pneumonia, mild, moderate, severe, and critical is for the COVID packages. But prior to the COVID, we have two for the pneumonia. The pneumonia for moderate risk and the pneumonia for the severe. The mild pneumonia as considered prior to the COVID is not being paid as an inpatient. Rather, it is part of our primary care benefit package.
So magkano yun? Magkano ang all-case rate nyo sa mild pneumonia? 44,000?
Well, before the COVID po, wala po tayong case rate for the mild pneumonia. It is being paid or part of the primary care benefit or
Dr.
the
Vargas,
outpatient.
you have two. The acquired pneumonia, which is 15,000, at saka yung
Severe po.
pneumonia, which is 32,000.
Yes, that is prior to COVID po. Nung lumabas po yung COVID, because the main condition then being attributed to the COVID as part of the presentation is the pneumonia. So yun pong naging package for the COVID with mild pneumonia po is at 43,000. Yun naman pong for the moderate is at 130 plus thousand. Yun pong for the severe, it's at around 300 plus, and yun pong sa critical is around 700 plus thousand.
How did you arrive at these amounts, Dr. Vargas?
Apo.
Dr. Vargas.
When the pneumonia, when the COVID started, Mr. President, Mr. Congressman, when the pneumonia, when the COVID started po, there were no standard, there were no clinical guidelines then because the guidelines po are developing and every day the signs and symptoms are changing. So what we did po to come up with the packages for the COVID pneumonia is we asked from the data from the itemized billing charges from the hospitals who already had pneumonia cases then because we don't have any experience on the COVID. Then we had based our management or treatment guidelines with those which are being established by the PISMID or the Philippine Society of Microbiology and Infectious Diseases and all the protocols that are coming out with the DOH. So technically the input po for the prices or the costs as we costed it are coming from the itemized billing charges of the
So
hospital.
ano yung i-itemize nyo nga sa amin kung paano dumating ang 44,000, paano ho dumating sa 44,000 yan? Magkano ang fees, magkano po ang gamot, magkano po ang kwarto, magkano po ano po yung breakdown yan, 44,000?
Honorable Remulla, while the Philhealth is preparing the presentation on how they arrive, kung paano nila nakuha yung bawat presyo dito sa COVID, meron sana akong presentation on the ECR. Pero madami-dami siyang slides. Pero these are all official slides. If you want, I'll present it and then...
Just finish this question, Mr. Chairman.
Dr. Vargas?
Yes, Mr. President, Mr. Congressman, yes, sir. We had a third party, the Palladium of the USAID, who actually helped us with the coming out of the packages. This would include, again, the accommodation, the drugs and medicines, the supplies, the PPEs, and the diagnostics, which are then costed, and the amounts or almost the median range of these cases came out as the package, 43,000.
Same rate ba yan, Dr. Vargas? Same rate ba yan sa public hospital at sa
Yes.
private hospital?
Yes, Mr. President, Mr. Congressman, yes po. We have the same amount for public and of course the private hospitals. Yes, sir.
So sa all case rate, Mr. Vargas, ilang percent ang binabayad ng Philhealth comparatively sa private sector, sa public hospitals, at ilang percent ang binabayad sa private hospitals? For anybody from Philhealth, baka may sagot na kayong ready dyan. Ilang percent nagpupunta sa private hospital, ilang percent nagpupunta sa public hospital?
Mr. Chair,
Go ahead.
Mr. Congressman, based on the 2019 data, we paid 58% of the total claims payment to private and 42% to government.
That is all case rates, lahat-lahat yan.
Yes, sir.
Okay, sige. 58 to 42 ang lumalabas na ratio. So mas maraming private kayong binabayaran kaysa sa public. Ang COVID testing is in the all case rate niyan, di ba? COVID testing.
Mr. President, Mr. Congressman, yes po. We pay po case-based payments also in COVID.
Magkano ho ang testing ng COVID sa all case rate ng Philhealth?
Mr. President, Mr. Congressman, the testing package po natin for all services is at 3,409. For if the kits are actually donated, if the testing kits are donated, we pay 2,077. And if all the services, including the kits, are actually provided or included already in the budget of the facility, we are paying around 900 pesos only.
Pero yan, binago nyo yan. Ano ang initial na inalaw na Philhealth para sa cost ng COVID testing?
Yes po. The initial case rate or case packages for the testing for all services being provided, it's at 8,150. For the donated kits, it's at 5,000 plus. But for the, if again, the third case, which is the donated and all the services are included in the budget, it is around 2,000 plus, sir.
So, nagbago yung rate.
Yes, sir.
Bakit nagbago yung rate? Ano nangyari at binago niyo yung rate?
Mr. President, Mr. Congressman,
Please address Mr. Chairman na lang.
Okay.
Mr. Chairman na lang kasi Mr. President is for the
sorry,
Senate. No?
sir. Yeah, I'm sorry, sir. Mr. Chair, Mr. Congressman. Yes, sir. When we did the initial costing for the packages of the testing kit, again together with a third party, we only had very limited sources of data then, especially konting-konti pa lang po yung merong accredited facility at the same time, konting-konti pa rin lang po yung merong mga testing kits available then.
Or then, Mr. Pargas, how long, ilan ang binayaran nyo ng 8,000 pesos para sa COVID testing? And kanino nyo binayad yung 8,000 pesos na yun?
Mr. President, Mr. Chair for a while.
Go ahead.
Kailan nagsimula itong nagpagbabago ng rates? Magkano ang binayad nyo sa 8,000 pesos sa isang COVID test?
I'd like to recognize the arrival of the President of the NUP, the Honorable P.D. Barsaga, who's here with us.
For the COVID, Mr. Chair, Mr. Congressman, for the COVID-19 testing kits, before the June 25, the total number of claims that we have is at around 12,000, and the total paid claims is around 2,181, and we paid around 9,863,000. For the COVID testing naman po, after the June 25, we have a total number of 38 claims so far, and still it is not paid and still unprocessed. That is as of July 31.
Mr. Pargas, meron ba kayong time limit sa COVID test? Kasi ang COVID test is only really good for 2 days. On the third day, wala na siyang silbi kasi wala yung information, di ba? Information is the key to COVID, di ba? How long, meron ba kayong timetable na dapat ilabas ang test within a certain period of time para ito ay bayaran ng Philhealth?
Mr. Congressman, wala po kaming, with regard to those protocols and guidelines, it is under the DOH po. Our particular function with regard to the testing is actually for the reimbursement for the
Pero di ba, you can also put in your own policy as to the efficacy of any procedure. Meron kayong mga iba-ibang departments, di ba? Napaka-top-heavy nga ng Philhealth eh. Pag sinabi nyo, di ba, kung alam nyo, sabihin natin, yung isang COVID test, 15 days walang resulta. Lumabas ang resulta on the 16th day. Ito ba, babayaran nyo pa rin ang full ito?
Yes, Mr. Chair, because the currently what we follow as a guideline, kung sino po yung babayadan namin, is the department order, the department memorandum of the DOH of who are going to be tested. Pero with regard po to the protocol on kung kailan lalabas yung mga resulta, kung gaano po kabilis yung resulta, hindi po kami ang nagre-regulate on that.
Mr. Chairman, I am asking that question because it's useless for Philhealth to be paying for tests where the result comes out very late in the day because these tests have no more value. Nobody is supposed to be reimbursed for a service that never really helped the person. Sa ganitong usapin, para naman parang hindi na ho reasonable na bayad tayo ng bayad kahit na hindi na ho paso na yung test kung tutuusin eh. 2 linggo bago lumabas. Di ba ho, parang wala namang hong visa na yun, Mr. Chairman?
Yes. With the, yung dumbo sa puntos na ni-raise ni Honorable Remulla, ang pagkakalam ko, meron na po kayong 1 billion for reimbursement na submitted po sa inyo.
Mr. Chair, I think the 1 billion that was stated,
Liquidated.
was on the liquidation with regard to the IRM.
Yes, pero kasama doon sa IRM nung liquidation, yung COVID testing, about 300 to 400 million, if I'm not mistaken.
Yun, opo. Yun po kasing ating Mr. Chair, yun pong ating po kasing pa-process, especially ng liquidation, pagdating po sa IRM, yun po ay naka-charge dun po sa lahat ng claims na
Kaya nga.
pumapasok po sa Philhealth.
All I'm saying, Mr. Vargas, is that yung binabanggit ni Honorable Remulla, isubmit nyo sa amin yung liquidation ng 1 billion, which includes actual persons, na yung mga tao na nagkasakit ng COVID, at saka yung testing. Nandun din yan.
Yes.
So can you kindly submit the liquidation ng 1 billion? Dahil yung pala nga nakikita natin sa ngayon, sa 30 billion o 30 billion, ang binigay ninyong pondo sa mga ospital ay 14 billion. Sa 14 billion, may 1 billion na na-liquidate. Yun ang para makita ni Honorable Remulla kung saan napunta yung mga yan at sinong gumamit ng mga ospital bukod dun sa nagkasakit at nagpa-testing. Honorable Barsaga?
Yes, just follow up lang for clarification. Pag nagbigay kayo ng IRM sa isang ospital na nag-treat ng COVID patients, yung IRM na binigay nyo, pwede nilang i-charge for COVID and non-COVID sickness. Just to clarify. Meaning to say, sa isang ospital, nag-treat ng COVID patient at the same time continuous ang kanilang pag-treat sa mga nanganganak, etc., etc., they can always charge that to IRM. Tama po ba?
Mr. Chair, Mr. Congressman, opo, the IRM po,
Okay na po.
Hindi, okay na yun, okay na yun. We will discuss the IRM later on. Kinaklarify labang natin so that yung mga kababayan natin, pati na yung healthcare institution at mga kawani nila ay hindi magkaroon ng misimpression na IRM can be charged only for COVID patients, even non-COVID patients, as long as they are confined in a healthcare institution, they can claim the Philhealth. Tama po ba? Okay, thank you.
Okay, so inulit ko po, no, ang discussion natin ngayon, papasok po tayo sa all case rate. Mamaya po, papag-usapan natin yung interim reimbursement mechanism. Kasama po dyan yung finance, na natanong na rin may katanungan rin si Honorable Remulla. Tapos yung computerization, OFW contribution, and COVID testing, kung sakasakaling babalik tayo sa tanong na yun. Honorable Remulla?
Ano na lang muna, Mr. Chairman, isa na lang, no, itong sa cataract na lang. Yung WellMed controversy, Mr. Pargas, you're very well aware of that.
yes, Mr. Chair.
Magkano yun na involved doon sa WellMed controversy?
Around, Mr. Chair, around 800,000.
800,000 pesos?
I'll confirm, yes. Yes,
Ms. Santiago, kayo na sumagot. Ano yung sinasabi niyo?
As far as I can recall po, ang nakita po na, Mr. Chair, na ghost patients, ang na-validate po na ghost patient, na walang, dead na,
Patay
is
na.
about 800,000. About 800,000 po.
800,000.
Opo. Yun na-validate po na patay na, pero nakaka-claim.
800,000 pesos yung claim.
Opo. Total na po yun.
Total claim.
Bali, hindi ko lang po alam po ilan yung claims nito, pero yung pong na-validate na patay na, mga 10 po yata, mga 800,000.
Mga something like 40 sessions. 40 to... Ilang sessions yun?
Kailangan ko po i-verify.
160 sessions.
Less, in total po, less than 160, yes.
Well, sige, Mr. Chairman, I will reserve my other questions for later. I would like to give back the floor to you.
Thank you,
Mr.
Honorable
Chairman.
Remulla. Sige po, para po sa guidance ng ating... yes, Honorable Barsaga?
Just a follow-up to the WellMed case. I have read from newspaper accounts, nabasa ko sa mga pahayagan na yung WellMed case ay na-dismiss sa Quezon City Regional Trial Court. Ang tanong ko lang, ano ang status ngayon? Did you refile the case? considering that the dismissal was made way back in 2019?
Mr. Chair, I think our legal can answer that.
Legal is recognized. May we know
Yes.
if we have the Attorney Del Rosario ba, ang legal natin? General Morales, nandiyan po ba kayo sa Zoom? Alam dito sa floor, kung meron po nakakalam dito sa atin, tungkol doon sa Philhealth case. At any rate, Honorable Barsaga,
Mr.
may we
Chair.
ask them to answer later on when
Yes,
we have
sir.
already them,
Or we
when
can
we already have them in Zoom. Sige po, sa lahat po ng mga kasama natin dito, and I hope General Morales is also here, magkakaroon lang po ako ng maliit na presentasyon. Alam niyo ho yung pinag-uusapan na mafia, at para ho sa guidance na rin ng mga kasama natin sa komite, makikita niyo po to sa inyo na ring mga ginawang pag-aaral ng COA at doon sa mga pulisiya na nanggaling sa Philhealth. Nakakalungkot pong isipin na patuloy taon-taon, magmula 2013 hanggang sa ngayon, bilyong-bilyong piso ang nawawala. At nakikita po to ng inyong mga opisyalis. Kaya po ko sinabing mafia to dahil mamaya papaliwanag ko rin yung relasyon ng bawat ospital at doon po sa nangyayaring pagpondo magmula sa ating Philhealth. If I may request mabilis lang po to, pero ito po yung mga official na dokumento galing sa Commission on Audit. Next slide. 2013, ang sinabi po sa inyo, kasi tandaan po natin, ang COA reports ninyo or ang COA findings ninyo, random check po yan eh. 3,500 a day ang inyong pinoproseso, kaya talagang napakarami at hindi kakayanin na COA na i-check ang lahat ng dokumento sa ilalim ng Philhealth. Anong sabi po sa inyo 2013? The validity of benefit payments amounting to 721 million in 9 Philhealth regional offices could not be ascertained due to the absence of billing statements from healthcare providers. Next slide. Post-audit of the benefit claims of 9 Philhealth regional offices, particularly on case rates and no balance billing, revealed that claims totaling 729 million were processed, pinroseso at binayaran ng Philhealth kahit walang statement of account, kahit walang billing. Ito po yung 2013. The actual amount of benefit payments granted to member, patients, and dependents. Next slide. Itong po ang mga lugar na chinek nila. Region 1, 3, 9, 10, 12, 13, arm and car. 729 million. Next slide, please. Sabi po ng 2013 pa rin, our audit of benefit claims filed by healthcare providers, either doctor or hospital, by Philhealth under the new Philhealth case rate system, showed that the healthcare providers were reimbursed the maximum allowable amount of case rates. At lumalabas po dito yung 46,164,000. Mas mababa ang lumalabas na billing kaysa doon po sa mismong binayaran ng Philhealth. So noong 2014, ano po yung naging problema natin? Next slide please. Ang binayaran ninyo na claimants, number 1 po dyan, pneumonia na. Pneumonia 1, 495,000. Acute gastroenteritis, 337,000. Newborn care package, 299,000. Ito po, galing daman po sa inyo. So noon pa lang, nakikita nyo na ang pneumonia, tumataas na at 495,000. Next slide. Ito po yung mga surgical case rates ninyo. Ano po ang pinakamataas dyan? 929,000 cases, dialysis. Next slide, please. Noong 2014, chinek po ng COA. Ito po yung COA reports po to, no? Region 6, ang sinabi niya, ni-reimburse ninyo ng full amount ang case rates. Region 1, yun din po ang sinabi niya. 1.691 million in 178 audited benefit claim samples could not be validated dahil hindi po ninyo pinapasubmit ng statement of accounts. Region 9, guidelines for the filing and reimbursement of case rates claim lack the necessary documentation and internal control. So ito po yung 2014. Ano po nangyari in 2014? Next slide please. Ito po yung cataract scandal. Magugulat po kayo noong 2014, 700 million sa NCR pa lang ang ginastos ng Philhealth sa katarata. So ang ibig sabihin, pag nakita nyo may ganitong problema, tumataas ang bayad, makikita ka agad ng finance kung anong nangyayari. Dahil ang mga regional offices nagsasubmit sa finance, central office, kung ano yung dapat bayaran. Next slide. Noong 2014 po, pang-apat sa pinakamataas ang katarata. Ang binayaran po ninyo dyan ay 3.7 billion. At hanggang sa, ang Philhealth case rate po, case rate din po yan, 16,000 bawat mata. Yung 16,000, isang mata lang po yan. Pagka nagpakatarata ka, nagpatanggal ka ng dalawang mata, 32,000. Ang sabi ng investigasyon ng panahon na yan, ang binibigay doon sa nagpapadala, 2,000 ang kanyang balato. At doon sa eye center naman, binibigyan siya ng 6,300. Next slide. So ito po yung 2014 nyo, lumabas na yung cataract removal at 2 billion pesos lumabas to 2014. Dialysis pa rin ninyo at 4,000. Kung titingnan nyo po yung dialysis ninyo, yung po yung nasa presyo nyo pa ata yan ng 4,500 ang case rate na ibinaba ninyo sa 2,500 nitong kailan lamang na 2016. Next slide. Eto na ho. 2014, nag 7.6 billion na kayo sa pneumonia. Yan po ang nauunan yung kaso. Yung gastroenteritis, yung UTI, 1.5 billion at gastroenteritis ay 1.3 billion. Next slide please. 2015, again, sabi ng COA, report niya to, ang chinek naman niya NCR at Rizal. Ang sinabi niya, doon sa katarata ninyo ay hindi nagkakaroon ng prior review. So ito yung review ng 2014, lumabas ng 2015. Pagkatapos, ang sinasabi niya dito, na maraming reimbursement not supported with complete documentation. At ito'y maaaring pumasok sa disallowance. 2015 ulit, next slide. Yung pong 93% or 26 na in-interview tungkol dito sa katarata operations. Ang sinasabi, mahaba yung kanilang paghihintay, hindi maganda yung nangyari sa kanila, at merong recruitment scheme. Ito yung recruitment scheme noong araw na binatikos na rin noong 2014. So pasok po tayo, 2015, report nyo po to. Next slide. Umakyat na po ang ating community-acquired pneumonia at 9.7 billion pesos. Acute gastroenteritis, 2.1 billion. Urinary tract infection, 2.1 billion. Next slide. Pagdating po sa mga procedure, ang pinakamalaking binayaran ay dialysis, pero pansinin niyo ho, nag-6 na bilyong kagad. Ang laki ng itinulon ng dialysis. Dahil siguro, nakita na nila yung kalakihan ng pagbibigay ng bayad tungkol dito, pero tingnan po natin. Next slide. 2016, NCR, 435 claims amounting to 47 million. Out of 518 claims, or 84% ang walang statement of accounts or billing. Binabayaran kaagad ng Philhealth nang hindi pa nagkakaroon ng billing ang mga ospital. Magmula po yan 2013, ganyan parating observation sa inyo ng COA. Doon po sa ZAY benefit package, dahil may package po kayo na ZAY benefit, sinabi niya nag-overpayment ng 7.36 million due to full reimbursements doon sa ZAY benefit package. Next slide please. Eto ho. Doon sa case rate, lumalabas, particular sa Region 1, ang actual charges 1 billion. Ang binayaran 1.4 billion. Sa Region 8, ang actual case rate nyo 9.5 million. Ang binayaran 15 million. So nag-excess amount na naman ng 5 million. Dalawang region lang po yan at ang tinest ng yan ay almost all 53 cases lang po yan. 5 milyon kaagad ang nakita na sumusobra na bayad. Makikita rin po dyan, 18 claims, 3.83 million ang overpayment. 2016, ito po yung mga community-acquired pneumonia, totaling 13.212 million, lack the necessary documentation. Thus, the validity and propriety of the disbursements could not be ascertained. Andyan po yung mga ospital. 13 million po to. Ang cases lang na to is 868 cases. Pneumonia, lahat. COA report 2016. Next slide. Sinabi po dito, yung hospital charges niyo, additional expenses of benefit payments, 5.8485 million. Actual benefit claim, 15 million. Ang sinample po nila, 1,375. Ang dapat lang pong bayaran ay 9,570,000. So the additional unnecessary expense paid by Philhealth is 5.484 million. Yan po yan. Please, next slide. Yan yung pinapakita niya. So ang kaso nito is, next slide please, 1,375 cases. Ni-review ng COA, 5.4 million kagas ang excess ninyo na binayaran. Ilan po ang kaso natin? Sa isang araw, 3,500 cases po tayo. So wala pong isang araw, 5 milyon na lumabas na pondong hindi dapat binayaran. Next slide please. Ang pneumonia nyo, binayaran ninyo is 9.4 billion in 2016, gastroenteritis 2.13 billion, UTI 1.8 billion. Next slide. Ang hemodialysis ninyo, nagdoble na ho. Naging 1.5 million claims na ho from 800,000. At ang binayaran ninyo ay 8 bilyong piso. Next slide please. 2017, NCR po at saka Rizal. Ang lumalabas na naman po sa ZAY benefit package ay nagkaroon kayo doon sa 2016 sample ng 15 million binayaran, 84 sample benefit, may 26 million na sobrang bayad. Next slide please. Ito po yung all case rates. Overpayment, 2.7 million pesos. NCR, Region 1 at Region 2. Next slide please. Sinabi po dyan muli ng COA, we reiterated our previous year audit recommendation that manage revisit the guidelines on the all case rate payment system and implement a uniform policy application on the reimbursement of the all case rate claims, which is equally beneficial to the Philhealth member patients and the healthcare providers in order to efficiently and effectively achieve its objective of providing its members the most advantageous financial risk protection through consistent and fixed benefit package. Ito po yung ZAY benefit package ninyo na ginawa noong 2017. Yan po yung inyong binabayaran. Pinakamalaki po dyan, well, iba-iba po to. Ang ZAY benefit ay special package ng mga may sakit. Next slide. In 2017, ang pneumonia nyo po ay umabot na ng 10 billion pesos. Pero ang cases niyong binayaran ay 700,000 ang binayaran ninyong kaso. Pero ang lumalabas po sa Department of Health na panahong yan ay 454,000 lang ang may kaso ng pneumonia. Yan po'y tanong ko rin sa DOH. Bakit hindi po nila nakita? 454,000 ang may sakit ng pneumonia sa Department of Health. Sa Philhealth, 707,000. At 10.2 billion ang binayaran na pondo para dyan. Gastroenteritis, 1.8 billion at UTI, 1.5 billion. Next slide, please. Ang dialysis po natin, naging consistent na at 1.6 thousand claims from 800 claims in the past. At dito po, next slide. Okay. In 2018, ang sinabi po sa amin ng COA, hindi po nila magawa ang audit dahil hindi po sila makapasok doon sa inyong mga computers. Pero I guess meron na po kayong study para dyan. But at that time, ang sinasabi lang, all case rate transaction amounting to 62 billion pesos. 62 billion pesos. And maybe at 2013 to 2018, on average, we are working on 50 billion on all case rates kada taon. Ha? Okay, next slide. Napansin nyo po, no, 1.6 million ang claims ng hemodialysis noong 2017. Ngayon, naging 2.2 million na po ang claims. So, from 10 to 14, na 800,000, naging 1.6. Ngayon, 2.2 na ang dialysis procedure. Yan po isang bagay na kailangan nating tingnan. Bakit ganun kalaki ang kanyang pagtaas? Next slide. Again, 757,000 ang claims ng pneumonia. Pero sa Department of Health ay hindi lalagpas ng 500,000 ang pneumonia claims, ang pneumonia cases. Gastroenteritis, 2 billion at urinary tract infection, 2.1 billion. Panghuli na lang po, ito po para makita ninyo kung gaano kagulo ang programa ng all case rate. Dito sa Pilipinas, pag ang gamit mong Philhealth, mas mabuti nang may katarata ka o may pneumonia. Kasi pag katarata, 32,000 pesos. Pag pneumonia, yung mild, 15,000 pesos. Pag medyo masama, 32,000 pesos. Pero pagka nagka-breast cancer ka, 11,800 pesos. Pag nag-ectopic pregnancy ka, 7,800 pesos lang ang itutulong sa'yo. Pagka ikaw na heart attack, ang itutulong sa'yo ng Philhealth ay 9,000 lang. Kaya mas mabuti na ang sakit mo, katarata o pneumonia, mas malaki ang bahagi ng pondong ibibigay sa'yo sa Philhealth. To the Philhealth, this is the scheme of sinasabing mafia. Because we know that on the regional level, meron po kayong tinatawag na benefits claim na committee. At yun po yan, dahil nga may case rate setup, ibibigay na lang yun sa finance. Pagdating sa finance, walang tanong-tanong dahil submitted ng region, babayaran ka agad. At pagdating po dyan, lalabas na ang pondo sa mga ospital. Kaya po kahapon, at nung isang araw nagkakausap tayo sa Philhealth, nagtataka bakit yung ibang ospital napakabilis. Bakit yung ospital mabilis mabayaran? Yung mga ospital natin, partikular, ang mga government hospitals, ang tagal ng bayaran. Dahil ba dito sa skema o nung scheme ng sinasabing mafia, na pagka merong usapan sa isang region o ang isang regional officer sa isang ospital at may usapan sa taas, mabilis ang nagiging bayaran. Ang all case rate policy po magmula 2013, consistent. Lahat ng binasa ko sa inyo ay galing sa Commission on Audit. At gusto kong malaman din sa COA mamaya, sino ba ang nakaupo ng panahon na yon? At bakit pinayagang magpatuloy? Mr. Chairman and all the members of the committee, lahat po ng government